Those were the complaints from hundreds of families with autistic children who needed insurance to cover their child's treatments. The Department of Insurance made an emergency ruling to change state mental health regulations. They say in 3 years, they've had 630 complaints about insurance companies not providing treatment for autism or requiring more tests, which would delay treatments. This new ruling allows people with autism to get similar coverage as all mental health patients. They can now continue treatments even when switching providers without having to wait on more tests. Well, the Obama administration says that 7.1 million people signed up by the deadline for the new health insurance plan. Many question those numbers and then bringing it back here on a state level. How are we doing in California? Well, our insurance expert Craig Gusson joins us here this morning to explore some of those things. Good to see you again.
Good to see you.
Okay, let's talk about that 7.1 million first off. The whole idea was to insure people who had not been insured before.
Correct.
Okay, how many of that 7.1 million are people that had never been insured before?
I don't know if we're ever going to hear that number.
They don't want you to hear that number.
They don't want you to hear that number because probably at the end of the day, it's not going to be that high, especially when you take away the Medi-Cal people. Because Medi-Cal really has grown a lot. So if you take those out, I'm guessing maybe 1 million people.
1 million people. So the whole idea was to insure 40 million plus uninsured people, and maybe 1 million have been insured. Is that a success?
I don't think so. I think there have been some positives to the new ACA plans. But on the other hand, we've gone through all of this. And at the end of the day, I don't really think it's accomplished the ultimate goal, which is to get everybody insured. Okay,
let's talk about if the dust is finally settling on this, for example. You're laughing, so I'm just going to guess the answer is no. We can move on. How bad is it?
It's bad. Monday was just a nightmare. I literally could not leave my desk. People calling all day, frantic.
Now, this was the final deadline here in California?
April 15th. Tuesday was the last day, but Monday, it was just frantic. You know, if you went to the Midway post office on Tuesday at 11:30, well, we had that Monday and Tuesday. Even Wednesday, I had 4 phone calls on Wednesday, people saying, okay, I want to sign up for health insurance. It's like you're a day late.
A day late and $1 short.
Yes, so it's been people calling up and having questions about their application. Is it done? I have a question about my benefits. When am I going to get my ID card? Stuff like that. And it just hasn't ended.
So if you haven't signed up for insurance yet, can you?
Only if there's what we call a qualifying event. A qualifying event is an event that caused you to lose your health insurance, or now you have the opportunity to get group insurance because you have a new job. So if you lost your job, got divorced, maybe moved out of state, and your coverage is gone, you can then qualify anytime during the year. But for anybody just to call me up and say, you know, I want to get health insurance, if it's been more than 60 days, you cannot buy it in California or in the United States.
What do those people do if they get sick?
Same thing they did before. They went to the hospitals have to eat the bill.
Okay, so far, then, again, we're looking for positives here. That part of the equation hasn't been affected in a positive way.
It hasn't. What the hospitals are going to do is you can sign up for Medi-Cal all year long. So,
but you have to qualify for Medi-Cal.
Right. So if you have somebody making $10,000 a year and gets sent to the emergency room, they're going to sign you up right there for Medi-Cal, and Medi-Cal will go back 3 months.
Okay, so at least some of the folks that are not currently covered, if they fit that income bracket, they will get insurance.
If not, they're going to.
You know, I've just got to make an observation here, Craig. I've known you for years. You've always been so enthusiastic. You love to come in here and share information with us about insurance. I'm just looking at you wondering if you're still enjoying your job or if you wish you'd gone into another career at this point.
I love my job. It's just been a really tough 6 months because no matter what we did, it just got worse. And it's to a point now where we're taking a step back and we're saying, okay, it's over. But it really isn't because we're still dealing with issues every day. And I keep wondering, and every agent I talk to says the same thing, when is this finally going to settle down? And I don't think so for a while because...
Now, when you say a while, I see deadlines that are out there a year from now.
Right. We got to start thinking about next year. Most agents I talk to and insurance companies are already thinking about how we're going to do next year. And in my office, we've been talking about that, and we're looking at, okay, we're going to probably have to hire 1 or 2 people because we realized, and every agent I talk to has realized how off we were thinking how all this was going to run.
And it's just not running anywhere
Not at
close
all.
to smooth.
Not at all.
Let me get into one question from a viewer here. This
Okay.
is from Nathan in Pacific Beach. Blue Cross moved me to a new plan in 2014. I just found out that my doctor is not in the network of my new 2014 Blue Cross plan. What options do I have?
This is the question I get every day, because what happens is if you're at Blue Cross or Blue Shield, you get a letter from the insurance company saying, hey, we can move you to a new plan, you can stay with us, and it's going to cost you so much a month, and it's really similar. You go, great, I'm done. Well, Blue Cross only uses Sharp and UCSD. Well, if you've been seeing a Scripps doctor, which was allowed in 2013, your doctor isn't allowed in 2014 because he's not with the Blue Cross
Wait a
network.
minute. You can't keep your doctor?
No.
The president said you could keep your doctor.
Well,
Over and
yes,
over and over again.
Over and over and over again, but you can't. And this isn't an event where people can, anytime during the year, be able to change their policy. This is one of the big exceptions to a new plan. Because if you're using Scripps, then you really want to look at like Blue Shield. They're the main writer of Scripps in San Diego, and HealthNet. So you want to have the opportunity then to be able to change because you didn't realize. And also, if there's also this other weird rule that just came out, that if you thought you applied for health insurance and you used an agent or a navigator and it really wasn't done, supposedly there's an opportunity you can also get on coverage.
This is, you know, it would be comical if it wasn't so tragic for so many people. This would be a business that would be out of business. Am I wrong in that assessment?
You're 100% right. I mean, if I ran Covered California, I'd be out looking for a job today because, I mean, you just can't run a business like this. But it's nationwide. I mean, I don't want to pick on Covered California.
Sure.
But this is a nationwide issue, and I think for the next 2-3 months, we're still going to be dealing with what about this and what about that, and I'm getting those questions every day.
All right, Craig, well, continue to come in and share with us. And again,
pleasure.
I appreciate your patience and helping everybody work through this and being there for folks.
I'm trying.
I know you are. See, there's the smile again and the enthusiasm. We got you back.
Thanks.
All right, thanks, Craig.